If you're experiencing physical discomfort or mood swings before your menstrual periods, you're not alone. These are symptoms of a very common condition known as premenstrual syndrome, or PMS. The physical changes of PMS occur before menstrual periods and can include weight gain, abdominal swelling, bloating, and swelling of the hands and feet. There can be headache, fatigue, breast tenderness, clumsiness, and constipation. The emotional reactions in PMS can include mood swings, depression, irritability, increased tension, and difficulty concentrating. Changes in sex drive can also occur. Some women with PMS have more of the physical changes, while others experience more of the behavior or emotional changes. Many women experience both. Fortunately, most women with PMS get only mild or moderate symptoms. But for others, PMS interferes considerably with daily activities, jobs, and social lives. The cause of PMS is not known, but it appears to coincide with hormonal changes that occur during the menstrual cycle. PMS symptoms have a highly regular pattern, occurring each month during the second half of the menstrual cycle, in the days just preceding menstruation. These symptoms disappear when menstruation begins, sometimes rapidly and sometimes more gradually. They do not return for about 2 weeks when the cycle is repeated. During an evaluation for PMS, examinations and tests may be recommended to make sure that other conditions which can be confused with PMS are not present. These include diabetes, thyroid disorders, allergies, emotional problems, and stress. To assist the doctor in making a diagnosis, you may be asked to keep a list of the type and severity of your symptoms each day through several menstrual cycles and to record this information on a calendar. You'll want to note mood changes, physical discomforts, and changes in eating habits. You may also be asked to take daily measurements of body temperature before you get out of bed in the morning, or what is known as basal body temperature. This helps in tracking hormonal changes. Once PMS has been diagnosed, treatment will depend on the specific symptoms and problems you are having. Sometimes medications are helpful in treating PMS. These can include pills, suppositories, or injections. Diuretics or water pills may be prescribed. Hormones or vitamins may be recommended too. Regular exercise and a healthy, low-fat diet are also important factors in reducing PMS symptoms. Reducing the salt in your diet may help decrease bloating. Try to eat less caffeine and chocolate too. This seems to decrease breast tenderness for some women. Be sure to read labels. Many soft drinks and over-the-counter medicines have caffeine added and are very high in sodium or salt. Some women find that eating small meals frequently throughout the day helps to decrease the urge to snack on less healthful foods. It also helps keep the blood sugar more stable. Sources of complex carbohydrates like plain baked potatoes or pasta are excellent choices. So are foods that are low in fat and high in protein. If you must have something sweet, try fruit. It's interesting to note that alcohol is metabolized differently by the body during this time, and its effect may last longer than usual. So you may want to minimize alcohol intake during this time in your monthly cycle. Some women with PMS find it reassuring to know that there is an explanation for their symptoms and that it is not in their head. The most important thing is to understand the way premenstrual syndrome affects you and those around you. With a little help and planning, it's usually easy to lessen the effects which PMS has on your lifestyle.